I'm Susan Dubois. I'm an endocrinologist and I work for community care health centers, and I support this work. Mary and I have been working together for about 10 years now, working with the Texas Drive family. So I'm glad to be here today.
So, Dr. Dubois, how can you help patients who have trouble affording their medications?
It's really important to know that. So the first thing I would say is tell us. Some patients will ration their medications. That's really common. So I might take my medication every other day or a half dose of my insulin and not tell their doctor. And then when we see you and you're out of control, what are we doing? We're adding more medications and more cost. So first thing, be honest, and try never to ration medications. Tell us if you're running out, and there are many things that we can do to try to bridge that experience. Um, so with Medicare, it could be that we just need to choose a different medication in the same class that's affordable. It could be that there are manufacturers' coupons. Those are available for most commercial medications that are newer and more expensive. The generic medications we might not have, but in the newer medicines that are heart healthy that we're trying to get people on that are expensive, if you'll go to the manufacturer's website, you can download a coupon that might get your cost from, say, $65 a month to $15 a month or something like that. Um, Even with Medicare plans now, there are prescription assistance programs through the pharmaceutical companies. And at community care, we have a lot of technicians that just do prescription assistance. Some private offices aren't as attuned to that, but our population has those challenges. So we have a lot of those people. So you download the forms and your doctor can sign them. And then the medication comes to you in 90-day supply for free, and typically you have to sign up every year for those plans. So that's another way. They used to exclude Medicare, but now people are understanding that Medicare is that there are these donut hole periods where you've spent all your benefit and now you have to go out of pocket for a while, and you might qualify for a program during the donut hole. There are other programs. Maybe you need to change to a different class of medication. So I think having that understanding of what's available at community care for our people without funding, we actually have a program that you can get called our sliding fee scale program, and that works for Medicare as well. And then you can have access to any of the drugs on our formulary, and it's typically about $7.50 a month per medication for our formulary items, and we buy them in bulk and get special pricing through the government through a program called 340B. And there's some eligibility requirements, but for people on fixed income or low income, that can be helpful. So I would just say, look for the programs. Make sure you give your provider plenty of time, because another thing that can happen is you might just need a prior authorization from your insurance company. That might be the nurse having to go on to a website and fill out a form. There may be some back and forth. So it could take a week or two to get a prior authorization. And God bless our nurses, sometimes they're on the phone for 2 hours trying to get one medication for a patient. So please be gentle with them. It's not that we don't want to help you, but it can be timely. So giving us time and advance notice. And the other thing I always tell my patients on insulin is lie. And by that, I always tell you to tell the truth, except the one time I want you to not tell the truth is I want you to always keep an insulin pen of each type you use or vial in your refrigerator that you don't tell anybody about. And you tell them you're completely out when you have your emergency vial left, because I never want my patients to run completely out of insulin. So in that circumstance, you should sound the alarm that I'm completely out of medicine before you really are, so you never run out of medication.